think clinical trials may be an excellent option for someone facing a diagnosis of lung cancer. I think it's really important to ask your doctor if there is a clinical trial that's potentially available to you for your diagnosis of lung cancer. I think clinical trials are evolving. It's really important to create clinical trials that will serve the population that is in clinic. And so one of the things that we're doing is trying to design clinical trials that really allow people that are in the real world to be a part of clinical trials with less strict criteria for entry of a clinical trial. And specifically, I think if there are language barriers, increasingly ask your doctor about consents that can be translated to the language that you are most able to understand the information. So having an interpreter, having a consent form that is translated into the language that you master is really important for a patient to enroll on a clinical trial. And that is something that should be available and that we should work on making available if it is not yet available. I will say the clinical trials in China and Japan, there are many trials that they are able to accrue very quickly. The US trials have struggled to have a more diverse population accrued to the trials, but I think that is something that we certainly are working on improving, and I think that is critical. I work with clinical trials, and so for me, when I meet a patient, I always try to understand and meet them where they're at. And that includes understanding their patient-family dynamics, their cultural beliefs, and then importantly, what they're seeking for in a treatment. I always bring up the option of clinical trials very early in our discussion because I would like them to understand that there are options. There's the standard of care option. Then there is a clinical trial option. And I always ask, would you be interested in a clinical trial, maybe a new treatment that could be a good fit for you that maybe you'd like to learn more about? And it's a very open-ended question, and I've found that most times people will say, sure, I'd like to learn about it. Again, I think if there are language barriers, one of the things that has been very helpful is talking to the family, talking to the patient, trying to understand how much information they want to know, how much information they're ready to receive. And if there is a language barrier, again, I think having a medical interpreter is very helpful so that both the patient and the caregiver and the family can have accurate information, reducing the risk of any sort of misunderstanding, and then also to be able to have them ask the questions in a way that they want to hear the answers with the assistance of somebody who's qualified to help us with getting the information, the optimal information to the patient and their family. I think it's also important within that context to just make sure that we're sensitive to the patient's culture and to make sure that we use a language that they will be able to absorb and, be careful using certain terms if it is a taboo. And then having a family meeting, making sure that you break down the information. I like to do it sometimes in different meetings because sometimes it's a lot to hear about everything all at once. So sometimes I will break it down and then say, why don't we meet again in a week and maybe have a family conference, making sure that everybody that is a key stakeholder or a key family member is there, creating a space where everybody feels comfortable to have that discussion about shared decision-making and respecting their values and preferences, especially with a diagnosis of advanced disease, which many times is the case with lung cancer, specifically talking about small cell lung cancer. I think, some of the challenges could be cultural barriers. Some of them could be geographical barriers, so challenges in getting to the bigger center for treatment, things like traffic, taking time off work if a family member is bringing them, and then certainly concerns about clinical trial and being scared about being involved in a clinical trial. And again, I think the important thing there as a physician and having a team, I always try to reassure the patients that if they are interested in clinical trial, there are a lot of things we can do as a team to help support them. So certainly giving them all the information that they need to make their decision, explaining it in ways that they can understand, giving them time to think through it, and then bringing them back to just consolidate all of their questions and make sure that they understand everything. And then with regards to the geographical barriers, I think a lot of our clinical trials now are incorporating assistance with transportation and assistance with getting to the visits, which I think is very helpful. And the last thing are the cultural concerns. I think if patients have concerns about Western medicine, I try to explain to them that this is sort of a holistic approach that we can all work together. You don't just have to do one or the other. You know, I view Western medicine as sort of an ally that, you know, you can sort of partner and do things together and work with the different healthcare teams to get you the best care that we possibly can.